Hi everyone. Today we are going to learn about zoonosis. And there are dollars HOD coming to the nursing department. In this sessions, we are going to learn about the meaning of zoonosis and types of zoonosis, the risk group who are getting to zoonosis, and the preventive measures of zoonosis. Zoonosis refers to diseases that can be passed from animals to humans. They are sometimes called zoonotic disease also. So this is from animal to animal or animal to human also will be possible. Animals can carry harmful germs such as bacteria, fungi, parasites and viruses. These are then shared with humans and cause illness. Zoonotic diseases range from mild to severe and some can even be fatal. The World Health Organization estimates that 61% of all human diseases are the zoonotic in origin. Types of zoonosis are avian influenza or bad flu, anthrax, bovine tuberculosis, brucellosis, Hansen's disease, otherwise called leprosy, trichinosis, swine flu, histoplasmosis. In this, we are all familiar with bad flu, swine flu, anthrax, and the brucellosis, even this leprosy. Let's see the mode of transmissions. So this transmission may be directly or indirectly or through vector-borne can be taken place. So direct contact involves coming into contact with the bodily fluids of an infected animals such as saliva, blood, urine, mucus or fecal matter of the infected animal. Touching or petting infected animals or being bitten or scratched by the water resources that are contaminated by the manure. So indirect contact means contact with an area where the infected animals live or roam, or by touching an object that has been contaminated by an infected animal. The common areas where this occurs include aquarium tanks, chicken coops, pet baskets, cages or kennels. Pet food and water dishes also will be the reservoir to transmit the disease. Farmers, zoo or pet shop workers and veterinaries have an increased risk of being exposed to this zoonotic diseases. They can also become the carrier and pass those diseases on to the other people. Through vector-borne, a vector is a living organism that transfers an infection from an animal to a human or another animal. They are often arthropods. The common vectors include mosquitoes, ticks, fleas, lice. Through that also, this zoonosis can be transmitted. The vector will bite the infected animal and then bite a human and transmitting the that is infection, that is microorganism and is exhibiting as a zoonotic diseases. So through foodborne also this zoonosis can be transmitted from one person to another person. This zoonosis can come from contaminated food products, improper food handling or inadequate cooking practice. People will get sick at some point of in their lives by eating or drinking contaminated food or drinking unpasteurized milk, undercooked meat or eggs, raw fruits and vegetables contaminated with fecal matters from an infected animal. Who are at risk to get this zoonotic disease? Pregnant mothers, infants, those who are taking chemotherapy, organ transplant, diabetic, infectious diseases, mainly AIDS patients. How we can prevent these zoonotic diseases? Fundamental concept in prevention and control and eradication of the zoonotic diseases focused upon breaking the chain of transmission at its epidemiologically weakest link in the infection cycle, controlling the reservoirs, breaking the routes of transmission and the immunization of the susceptible host, that is human being. Let us see about the levels of prevention in preventing zoonotic diseases. The primary prevention is preventing exposure to causal factors. Example, quarantine and vaccination. If anyone is infected and we are having the signs and symptoms of the disease, better to quarantine them and those who are taking care of their patients can be taken up the proper vaccinations, including that pet animals also. And the secondary preventions to detect the disease process as early as possible before clinical disease occurs. That is, screening test to be detect the diseases like tuberculosis, bovine tuberculosis, brucellosis, and test the slaughter and the depopulation's milk ring test. And tertiary prevention, that is the proper treatment to avoid getting any complications. Let's see the common preventive measures of this zoonotic diseases. Keeping the hands clean. Those who are handling the pet, those who are handling the food, better to always keep your hands clean. Choosing a pet wisely. Preventing bites from the mosquitoes, ticks and fleas. Using bug sprays, wearing long trousers and sleeves, and staying away from the wooded areas can help prevent bites. Handling food safely, that is by ensuring food is cooked properly, preparation areas are be clean, and by washing dishes and the pots after use. Researching diseases before travel. Taking precautionary steps with the vaccines are essential. So researching diseases from before travel means when you are traveling to the other country or other states. So is there any infectious disease or zoonotic disease like swine flu or bad flu is prevalent there, then we have to take the precautionary steps. Better to avoid to go there or to take the vaccines before traveling to that place. Let's see the principles of disease control. This main principle of disease control is breaking the chain of transmission. That is the main thing to control or eradicate or preventing the zoonotic diseases. And the other principle is reservoir neutralization. That can be do by do early diagnosis of the disease and kill infected animals, manipulation of environmental culling of birds during avian influenza outbreak. Second one is transmission from reservoir to susceptible host, that isolation and treatment of infected animals, quarantine of susceptible animal, and the population control. Third thing is transmission between the susceptible host, that is immunization or chemoprophylaxis can be taken. Chemoprophylaxis means those who are handling this infected animals or infected human beings. So before developing any signs and symptoms or getting the infection, that people that who's taking care of that animal and the human being, that people can be taken some kind of antibiotic as per the doctor's advice. Let us see some of the approaches to prevent these zoonotic diseases. First one, quarantine. As we all know that is meaning of quarantine. Okay, so quarantine, simple meaning is 45 days of isolation. Okay, so here once the person having the signs and symptoms of disease are diagnosed with a zoonotic disease, better to isolate them. Test and slaughter. So before killing the animals for food purpose, should we test if they are having any zoonotic disease in that animal. Environmental hygiene, mass communication to create awareness, vector control, reservoir control, early diagnosis, treatment, that is the proper treatment for the proper disease, genetic improvement, health education. So quarantines, isolation of animals that are infected or suspected to be so, or non-infected animals that are at risk. The period depends on incubation period, time taken for infection to be confirmed, time taken by the infected animal to become uninfected. Hygiene, the proper ventilation, clean water informs, pest control, improvement of housing, general cleanliness, the proper disposal of dead animals, including pasteurization of milk. So far we have discussed about the meaning of zoonosis and types of zoonosic disorders and the risk group to or easily get the zoonotic disease and the preventive measures of zoonotic diseases. Let me conclude this topic. 61% of the people affecting with the zoonotic as worldwide. Although zoonotic diseases are common, some people are at higher risk of getting them. These individuals may also have more severe reactions and symptoms. They should seek medical attention immediately. High-risk individuals include pregnant women, adult age 65 and older, children 5 years older or younger than, those having HIV, those with cancer who are going through chemotherapy, others with weakness in the immune system. This is a reference of this zoonotic disorder. Hope you understood about the zoonotic disorders and its prevention. Thank you for your patient listening.